Well, blessed day, everyone. Welcome back to EMNC LMT course. And again, I'm Dr. Leslie May Favenier Damagas. And my topic for today is actually not new to you anymore. It's just actually a review, okay? And it's all about how milk gets from breast to baby. Now, after this session, I expect that you will be able to identify the parts of the breast and its functions, and that you may already be able to explain how breast milk is produced in relation to the hormonal stimulation, and you may be able to describe the role of baby in milk transfer, and of course know the simple and proper breast care. Now, of course, you already know that breast and baby are elements necessary in normal breastfeeding process. And so that the breast is the one that produces and releases the milk, and the baby is the one who removes the milk from the breast with effective suckling. And the manner by which baby is attached to the breast will determine how successful this two comes together. So just a review. Okay, so let's start from the outside. As you can see here, the nipple as the exit point of the milk, okay, that is transported from the ducts. And you have here the areola. Here are you, cursor. Okay, here's the areola. There. And it is actually the brown pigmented region surrounding the nipple. And we also have now the Montgomery glands there. Okay. And these appear as small elevations in the alveolar surfaces. And these are the combinations of milk and sebaceous glands that act as lubricants for breastfeeding to prevent chapping, cracking of the nipple during breastfeeding. And of course, we also have here now the supporting fat tissues. So there. So supporting fats and tissues which also give shape to our breast with appropriate estrogen stimulation. And of course, the basic component of the mature breast milk or the mammary gland is, or these sac-like structures, balloon-like structures called now the alveoli. And this contains the blood supply, muscle cells, and milk secreting cells. And when these alveoli join together to form groups, they're called now your lobules. And we have around 12 to 20 lobules organized around the nipple. There. And each lobule has a duct called now the lactiferous ducts. These lactiferous ducts now thrust the milk now into the nipple, okay, then for the baby to suckle. Now you can see here a bigger view of the alveoli. Okay, this is very important that because these alveoli are the site for milk production and storage, especially when they receive the appropriate hormonal stimulation. So what are the important hormones involved in breastfeeding? So let's start first with the prolactin. So prolactin is a pituitary hormone that establishes and maintains supply of breast milk. It actually makes alveoli produce breast milk, and it works after a baby has taken its feed. And its level is really high 2 hours after birth and at night. So that it is very important not to miss the second hour period and the night breastfeeding time for continuous production of milk. And another hormone that is released during breastfeeding is the oxytocin. And this naman causes the muscles around the alveoli to contract, followed by squeezing the breast milk into the ducts, pushing the milk further out of the nipple to be taken by our babies. And the release of this milk is now called the milk ejection or the milk letdown. Now, besides the milk letdown or the milk ejection, what other signs that your body is releasing oxytocin? Now, if painful uterine contraction and cramping of uterus are experienced by your patients, then it's a sign of a good oxytocin reflex. Also, tingling and needle and squeezing sensation in the breast is also one of the signs. And leaking breast, which is not suckled, it is a very good sign that there's an oxytocin reflex. Now, how about hearing baby swallow milk while breastfeeding, or a sudden thirst from mom, or a feeling of happiness, or feeling of being happy, feeling of being comfortable, relaxed after feeding? Those are also good signs of oxytocin release. However, if the mothers complained of extreme pain, fatigue, or they feel sad, feel nervous or anxious, stressed, embarrassed, or maybe because they are not really believing in breastfeeding, or maybe they're under the influence of nicotine or alcohol, then tell them that their oxytocin reflex will be affected. And of course, it will keep their baby from getting milk. And so here, I'll show you a picture on how oxytocin reflex works. So remember that the success of breastfeeding starts from the brain. So if the mother really thinks right, okay, thinks positive thoughts, feel confident, feel happy, okay, there will be, tell them that there will be a very good oxytocin release. But if, for example, mother is filled with negative thoughts, negative feelings, or maybe filled with only doubts, anxieties, okay, always thinking to go back to work, then this oxytocin reflex will stop. And so it is very important really to tell mothers to think right. So she'll feel right, she'll feel good, and she will act right. And then, okay, let's assure her that there will be a very good milk ejection, very good milk ejection and production of milk. So, isn't this a very good, a very amazing principle? Also, yeah, massaging the back may also be of help in oxytocin reflex stimulation. So likewise, if you have hormone that will stimulate milk production and milk letdown, there is also a hormone that will also suppress milk production. And this hormone is called now the feedback inhibitor of lactation. Remember, okay, the amount of milk produced depends on how much milk is removed. So if mothers do not empty their breast regularly, if moms will not really offer their breast regularly to their babies, then of course FIL will be activated, okay, and it will inhibit further milk production, and of course there'll be less supply of milk. So that to prevent FIL from accumulating, let us make sure that baby is really well attached to the breast, and then encourage frequent feeding, and tell mommies to allow complete emptying of the breast. Finish one breast before giving the other. And if baby really cannot suckle, then let's help them express their milk so that breast milk production continues. Now, so that prolactin, oxytocin, and the removal of the feedback inhibitor of lactation are dependent on the effective suckling of the baby. Didn't you notice? So the absence or the weak suckling means no milk production, nor milk letdown. So what can you see in this slide, in this photo? Do you actually know when to say if your baby is well attached to the breast or poorly attached to the breast? Now here on your left, there, you can see that as mouth is widely open, the nipple and the areola are both inside the mouth. You can see this areola is more visible above the lip, and the lower lip is even turned outwards, and baby's chin is also touching the breast. There. See? And so this is a picture of a good attachment of the breast. And on your right, now you can see here that there is only a small opening of the mouth, okay, with only nipple inside it. And then the areola is very visible above and below the lip, and the baby's chin is not even touching the breast. And so this depicts now the picture of a poor attachment. So for effective suckling to occur, we should really have a good attachment. Ang tawag ko po dito ay subsob. Dapat nakasubsob si baby. Okay. So by the way, how will you know that the baby is suckling well? So we have to fulfill 3 actions for successful suckling. We have here the rooting reflex, the sucking reflex, and the swallowing reflex. There. So when nipple comes in contact with the lip, there, nipple with the lip, that is what we call now the rooting reflex. Okay, here in the picture A. And when nipple now comes in contact with the tongue, where are you, cursor? Okay, here's the nipple in contact with the tongue and the roof of the mouth with, of course, some squeezing action. Then it's called sucking. Here, this is now here in the picture B. And now the third one is when there's a squeezing action that allows infants now to extract liquid. Well, of course, it's not seen here. Extract liquid from the breast and push just at the back of the mouth into the esophagus there. Then it is now called swallowing reflex. And this will now complete the process of suckling as seen in picture C. So all these 3 should occur simultaneously, one after the other, for effective suckling. So if you observe the baby who has slow deep sucks with short pause, or if you hear your baby swallowing, or the baby's cheeks are full during a feed and is able to finish the feed and release breast by himself, and baby looks very calm and contented, and the mom does not even really feel the pain during breastfeeding, then it means that your baby is suckling effectively. Amazing, right? Oh, by the way, hey, please do not allow any pacifiers or teats not to be used in between breastfeeding, as it will just cause difficulties in suckling owing to its different mouth action. Likewise, what if the baby comes to prefer already the artificial teats? Then the suckling time at the breast will already be reduced. Then, because it will be reduced, then there will be less stimulation of the breast, and of course, less milk production. So again, the less demand for the milk, then less supply. So again, what are the ways to keep the milk production plentiful? Again, initiate breastfeeding soon after birth. Make sure that baby is well attached to the breast. Do not give artificial teats or pacifiers. Breastfeed exclusively. Feed on demand basis and feed at night when the prolactin release in response to suckling is very high. And what do mothers need to know about caring for their breast when breastfeeding? Again, just washing the breast once a day as part of the general body hygiene is already sufficient. Just clean with water only. No soap, no oils, no Vaseline, no lotion. So in summary, I've discussed with you the parts of the breast and its functions. The critical role of baby's regular and effective suckling in the milk production, letdown, and transfer. And I've discussed to you the law of supply and demand, the role of the hormones when there's good attachment of the breast, effective and regular suckling, and the simple and proper breast care. So thank you very much for your kind listening. And please don't forget to take your post-test. And I hope to see you again next week for our new module discussion. So thank you again, and God bless us all. Bye.